Hello and welcome to the second episode of the Mental Health Weekly Update. I'm your host, creator, and licensed therapist, Heather Jade Wright. If you're enjoying this series and want to keep up with all of the videos I post, go ahead, subscribe, and hit that notification bell so you don't miss any new videos. Also, click the like button so that this video can reach as many people as possible, helping us to destigmatize the SHIT out of mental health. With that said, let's get into the news of mental health. Time magazine published an article about the effect of the coronavirus pandemic on Americans' mental health. The study is being done by researchers at San Diego University and Florida State University. Shout out to my alma mater. The research was gathered just last month in April. The data revealed that 1 in 4 Americans met criteria for serious distress. That's about a 700% increase compared to pre-pandemic numbers collected in 2018. Those found to be in the most distress were young adults ages 18 to 29 and those that have children under the age of 18. Among the adults living at home with kids, the rate of severe distress rose from 3% in 2018 to 37%. And similarly, in young adults, the rate of distress rose from just 4% to 38%. So what do we do with this information? Well, Jean Twenge, one of the researchers of the study, summed it up well by stating, quote, "If there's a policy message here, it's that people are suffering and we need to put resources into mental health treatments." Well said, Jean. The study is still in process since it's not yet been peer-reviewed, but if you're interested in more of the details, I've posted a link to the study along with the Times article below. So with most of us experiencing an increase in stress, what can we do to help ourselves through this? Well, I've posted a video providing you with information for free mental health apps, so check that out if you haven't already. But I have another suggestion that is also completely free, and that's journaling. Look, I've journaled for most of my life, but is it really helpful? I felt that it has been, and research actually shows that to be true. In a study conducted by researchers at Penn State, journaling was found to be associated with better mental health, including lower anxiety, mental distress, and after only 1 month of the intervention, it was associated with reduced mental stress across time. This study in particular measured a specific type of journaling, focused on positive life aspects. The journaling focused on making meaning out of or finding benefit in past experiences and focusing on positive aspects of one's self. Now, from experience, I can tell you that it feels great to rip up and throw away your old journals, which is what I did in my 20s while going through a quarter-life crisis. Happy Mental Health Awareness Month! Yep, May is Mental Health Awareness Month. So let's talk about an important and timely issue that we can all advocate for. On April 28th, a bill was introduced to the House of Representatives, Bill H.R. 6644. This bill requires health insurance to cover for services provided via telehealth during the COVID-19 emergency, if such services would have normally been covered in person. This could make a huge difference in access to care. For example, I've been seeing clients via telehealth, but is insurance going to cover that? We aren't 100% sure. Some insurance agencies have committed to paying out, but this bill would ensure that it happens. You can help advocate for the bill by calling or emailing your representative. Currently, it's being reviewed in the House, so you want to contact your House representative. If you aren't sure who that is, you can easily find out through a quick Google search. I've written to mine, hello Chuck Fleischman. To keep up to date with new mental health bills and advocacy issues, check out NAMI's website at nami.org. NAMI stands for the National Alliance on Mental Health. It's the nation's largest grassroots mental health organization. Did you know that talking to yourself is normal? In fact, it can be helpful. Studies show that what matters is how we talk to ourselves. Now, I can make an entire video on this topic, and I probably will, but what I'd like you to practice is noticing how you talk to yourself, whether it's out loud or in your head. Is your inner voice hard on you, kind of mean? Well, studies show that if we talk to ourselves negatively, we're more likely to guide ourselves to a negative outcome. However, if we use neutral or positive statements, then the outcome is usually more effective. Also, in a study of athletes, using the second or third person was found to be helpful to their performance. For example, using a phrase such as, "You've got this." When athletes used it in the second or third person to talk to themselves, they were found to just do better. Again, that's if the self-talk statements were positive or neutral. So I encourage you to practice noticing your self-talk. And if you find it to be pretty mean and judgmental, first just recognize that self-talk is not factual. Just because your self-talk says you suck doesn't make it true. Now, if you can create just a little bit of space between yourself and your buy-in with self-talk, you can start to shift those statements. It might be difficult to instantly turn them from a negative into a positive statement, so you can start first by focusing on making them neutral. This whole self-talk thing makes a huge difference in how you feel and just how you go about making choices in your life. If you're interested in this topic, there are some great books that can help you with this. I highly recommend Michael Singer's book called The Untethered Soul, which you can find on Amazon or basically anywhere you buy books. All right, that takes us to our last segment, which is our mental health hero of the week, Kati Morton. Kati is a YouTuber and has tons of videos on just about every mental health topic you can imagine. She's also a licensed therapist and specializes in treating those with eating disorders. You can access all of her content on YouTube for free, and you can find her on all of the other social media platforms. Thanks so much for watching this second episode of the Mental Health Weekly Update. I'll be posting more videos and continuing to post this weekly episode series every Sunday. Until next time, let's take good care of ourselves and each other, and remember to stay present and breathe.